Hello, my dear ones. It's always a pleasure, always an extreme pleasure. Someday I'll have more time to sit down and knock a whole bunch of these out for you and to give you the value of these is learning your different cases. Even though we sound like a broken record. I laugh about, and some of you guys are laughing out there, and I have to. I said this before. You guys are on the cutting edge of wisdom and knowledge. You don't have to have academics out the butt because it doesn't serve anybody well. Take a look at the most academically inclined. A good example was Stephen Hawking. I mean, extremely intellectual, but lost the idea that God didn't exist. And I think, and he only had ALS. ALS, guys, any of you guys, Shane, you guys could have got Stephen Hawking out of that chair and walking. I've said that way back when. We've had cases like that. We've had ALS just like him, but maybe not as a bit, but real close. Got him up, got him straight, got him walking. So that's the sort of thing, but he wasn't privy to that awareness. Sad, because I think with the spiritual side of that, he would have been a kicker. But it wasn't meant to be. And so you can't judge on those sort of things like that, But you guys are on the cutting edge of awareness. We introduced the lymphatic system to this planet like it's never seen it before. Now, this is funny because, this has been shoved in my face and I have it at home to read and I haven't read the whole thing, so I'll do that. But what is that, $1 billion for cancer moonshot or something? I don't know. Anyway, this is, it says, scientists said in a study published Tuesday that they may have stumbled on a previously unknown organ, one of the biggest in the human body, and one could significantly advance our understanding of cancer and other diseases. They can't get rid of labels and putting diseases, that whole consciousness in there. And I thought it'd be interesting for us to watch them as they discover, and as you guys educate them, and they discover the great lymphatic system. It's going to take them a while. They're generally about 30 to 50 years behind us. It wasn't that long ago we as naturopaths recommended vitamins and minerals, right? You need a little D maybe. Oh man, we were reamed, we were called charlatans, we were called everything in the book, right? Well, how many years is this? When they started recommending, I'm going to say about 35 years after I started, they finally started recommending D. So now you go to medical, you need D, you need B12, it's like, wait a minute, guys. You're the one that said we were like worthless humans because we recommended them then, and now you recommend them and it's okay. I mean, you see where I'm going? So you guys are at the cutting edge of understanding the human body, how it works, the acid side of chemistry. You guys are so far advanced with that. That's what we need, though. They're going to be loping around while you guys are curing people all over the world, and they're going to be still, well, we think we found a new organ in the body. Miles of interstitial spaces, and they get into the interstitial spaces, of course. No kidding. There's spaces around every cell that you have, no question, right? We talked about that, and bone included. What's in these spaces around the cells? Well, how do you get to the cell in the first place? If I want to help my cells out, right, which is structure function, which consists of everything, hair, lips, ears, skin, legs, muscles, it's all cells. And there's spaces around every one of them. So we're roughly, it's between, let's say 75 trillion and 100 trillion cells that comprise the human body, and you have spaces in between them. How did the medical doctors ever think that how the body got rid of its sewage? How did it ever think how the cells got rid of its waste back in the blood? And that's what they think. And it's like, then you really didn't study science well. Then you really, when you take a look at that, and even in A&P, antiquated thinking, very antiquated thinking. You've all met Pat here. She's been on some videos. She's our A&P professor, medical doctor lady. Pretty interesting when you see an A&P professor go, oh, wow. When I first met her, she said, you answered all the questions we had. And it goes on, the research published in the Journal of Scientific Reports suggests that a network of dense connective tissues and fluid-filled compartments called the interstitium is a full-fledged organ. That is a group of tissues with a unique structure performing a specialized task like the heart or liver. What? I mean, you gotta, God bless them anyway, you know, they're coming along, you know, but you guys know the truth, and you want to always be that way. You always want to work getting out of your mind. I know that sounds pretty crazy if you're just watching these videos, but if you stop thinking, your awareness will explode, and you will start to see and know things that this planet doesn't know yet. And there's a lot of it. This planet is still in its infancy, and there's areas of creation you can go to see what's going to happen here. And it's just wild. The whole thing is fun. The whole thing is wild. And, you know, I appreciate you all coming aboard, because you guys already know all this. And matter of fact, they're thinking it's an organ. I mean, you could. That would mean the blood vessels are organs. You know, what about the lymph fluid? You know, but it's just what you guys already know, but you guys know so much more. I find this interesting. More than 2/3 of the human body is water, blah, 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 blah. Most of the rest, is 20% of the fluid in the body is interstitial. Oh, well, wait a minute. So we got roughly 75 to 80% interstitial fluid versus what? 25% blood? So, blood is so important, which we all know that, of course. What would 80% of that fluid be that wouldn't be important? You know, for not understanding interstitial fluid like that is shocking to me in a modality like the allopathic community, because of not understanding that system, not understanding acids and the acid side of chemistry and the effect that that has in the human body, and the calcium buffering systems, the cholesterol systems, all of this, it leaves these practitioners out in the cold. So what needs to happen is the medical community needs to reduce itself to surgery and emergency medicine with naturopaths on staff. Then the rest of the medical doctors, you all need to become naturopaths, but not from Bastyr or Southwest, because they don't know the first thing about health and wellness. Get to a bona fide naturopathy school. Then you will learn the truth about foods, chemistry, the body, things that are actual factual, and not things that fly around like fairies in the sky, even though fairies in the sky do exist. But interesting stuff. I had to laugh at this, and it's like, what? You guys are so far advanced in that, but you have interstitial spaces everywhere in the human body, everywhere. That's what makes detox and all this. Remember, allopathy sees things that they want to attack, they want to treat, they want to lock in, they want to suppress. You all know it, those that have had any type of eczema or psoriasis or anything like that, you know exactly what that is in taking steroid creams and the like. Nature gets rid of chemistry it doesn't want. It doesn't lock it in and then put more chemistry the body doesn't want, and chemistry that can kill it. It doesn't do that. Why do we do that? Is this how lost man is? You know, and we have people lining up to get juiced and everything else. It's like, what? So humans have to raise their consciousness up a little bit and get out of the dark agey syndrome, because allopathy is very dark agey thinking. You guys are on point, you're on top, you understand, you're raising your children, you're regenerating genetic weaknesses, you're getting rid of the tumors and understanding the lymph system. And that's what we're working on, is the lymphatic system. Sounds like a broken record, but look what's creeping up on this. In other words, allopathy doesn't know the first thing, how to make people well. You guys are demonstrating that. People out there are getting cured. I mean, it's phenomenal. So pretty soon the attention is going to move toward us, because you can't deny the fact that you can take a Stephen Hawkins and get him out of that chair. If allopathy could, they would have done it. They can't do it because they don't know about regeneration. If you don't know about the lymphatic system and the blowback of acidosis on tissues, then you're out in the cold. So all these pathways, realize that these deal with acids. Basically, the blood deals basically with base chemistry, acids, but base chemistry predominantly, low-level acids. However, you're getting into your hotter acids through the lymph system, and that's why it's, again, lipid-based, cholesterol-based. That's why your HDL is in the cell wall and your LDL is in the fluid. It really makes it's a buffering system for acid damage. Acids are corrosive, and when you get against acid, look at metals coming together. I mean, you see the corrosiveness of acids in life. It's well established in chemistry. So if you're eating foods that are acid forming, and all your activity, of course, is acid forming, right? And you have acid forming thoughts, negative thoughts, gossiping, backbiting, talking bad about others and stuff like that, or you're trolling on the internet trying to get, all those are acid. Your feeling of despair, those are all acids. So you can get acidic all the way through your beingness. And we need to change that, because that's limiting you and reducing your awareness and reducing your life and reducing the vitality of the human body. It is the inflammatory issue. So when you're detoxing, remember, when you're acidic, these spaces, interstitial spaces, the interstitial fluids, we'll back up. When you're on a high protein type diet, which man has for many, many, many millennium, this has destroyed literally kidney and gut tissue. So where man has the bulk of his problems are in his eliminative organs. Blood does not have an eliminative organ. The liver is not an eliminative organ. Your kidneys, your skin, and your GI tract is. Of course, every other hole becomes an eliminative organ. When you get backed up with mucus so much, you start oozing it out the eyes and the nose and the mouth and everywhere else. Belly button. Because your tank is full. So these interstitial spaces are that's how the body gets rid of cells that are damaged, and how the body gets rid of acid waste, metabolitic waste. It's that simple. Cells that are damaged cannot enter the bloodstream. And you could understand why. That blood is a very protective fluid for obvious reasons. It's the life-supportive nectar. It's the electrolyte, should be the electrolyte nectar, the energetic electrolyte nectar, which balances out the massive amount of acids produced in activity. You're out there walking and running, that's lactic acid, you're increasing breathing, respirations, so your phosphoric, your carbonics, all your acids are increased. And so how does the body deal with that? Oh, it all converts to water like carbon dioxide and then gets out of the body? No, not at all. Or you wouldn't have a symptom 1. Oh, these are diseases that come from where? Oh, flew in from somewhere, I guess. Maybe another planet. So that's, you got to look at the cause and effect of reality. Reality, truth, is cause and effect. You don't label it as cause and effect. What did I do to get this effect? And you have to trace it back. Whether it's chemistry, physics, it doesn't matter. What did you do? What did you initiate? What action did you take to get the effect that you're experiencing? Because that's all life is. In the lower levels, we judge cause and effect as being good or bad. Oh, we didn't like that one. That kicked my butt. I didn't like that at all. That's negative. But in reality, that's a label that we give duality because we didn't like the outcome. It had a negative effect on it. However, when you get back and look at it, those actually have positive effects because that's how we learn and grow. So things just are. So when you get out of the mind, there's no labels for anything. Why label anything? Just live in the moment as things just are. See things for what they really are. It's kind of like people are so backed up lymphatically and the mucus in the sinuses that most people, and we talked about this before, actually smell and taste by memory. By memory. And so when you clean that out and you actually start smelling again, it's nirvanic. When these senses of the human body, there's only a little 5 of them, when they're up and going, it's amazing the human experience, let alone the tremendous experiences in your other bodies. Amazing stuff. But when the kidneys have to deal with so much acids that it swells and inflames the kidneys, breaks the kidneys down, or you're genetically weak in that area, or the adrenals are going down, or the kidneys back up into the adrenals, and so there's no more filtration. The medical people have to learn filtration. They killed one of ours when he was filtering. Loaded him, thought he had a massive infection, loaded him up with antibiotics, and killed him. Killed him right there in the hospital. His wife watching knew that they were going to kill him. You know, he was well. And you know, this is the sort of problems you run into with antibiotics. This whole bull crap about antibiotics. Why would you kill the bacteria in your body? And why would you blame bacterium in your gut, E. coli and all that crap? These are opportunists. In other words, if you have a culturing medium, you have meat and you have putrefacted material in your bowels, you're going to call up the wild ones. You're going to call up the bacterium carnivores. See, you've got bacteria for every single thing in the world, including all the metals. I forget how many bacteria there are, varieties, but there's buku bunches of them. There are friends. They're needed in our world. If you put your inner terrain full of acids and proteins and things like this, don't get mad when bacteria come in to help try to clean your body out. So this lymph fluid is bigger than the blood fluids. So you have cells that are damaged, can't travel in the blood, guys, has to go through the lymph system, this new organ that hasn't been found yet. And so then it goes to the lymph nodes. Why to the lymph nodes? Why would you take a cell to the lymph nodes that have been damaged? Well, you can't take a cell and dump it in the blood. That wouldn't work out with the pH and all that of the blood. So what's significant about taking a damaged cell? Why wouldn't we have cells, we'll use the name macrophages, in tissue? Why do we find the macrophages, the carnivores, in the lymph nodes as opposed to in the tissues? Can you imagine with man's state of lymph stagnation, the amount of cannibalism that can go on in tissues if you had macrophages in the wrong places? Because we have lowered the electricity and the consciousness of our cells genetically. And everything is magnetic. So when you lower energy, that actually pulls the carnivores of life in. The smell and everything that is associated with lowering one's systemic energies then calls different creatures in to help deal with the issues. Because death then has to be dealt with. You have to break the complex structures like digestion, like the human body, back down into the atomic structure so we can all use those atoms for something else. So we have to leave our physical bodies here. You know, and that way we can use the atoms here. And you just have to get used to the fact that you're not your physical body. You're only using that. That's your vehicle. Get it nice and clean and nice and healthy and strong so it works for you well. But it is not you. And don't get lost in that. But these interstitial spaces, when acids accumulate, they're corrosive. So it first creates inflammation and a tear. But then it creates a cationic. Now, a catabolic is an aggressive tear apart. In that process, however, you create dehydration because you're burning your electrolytes, and if you're on an acid-forming diet and your electrolyte consumption is extremely low, then you're burning the systemics. Now you're pulling calcium out of structure, connective tissue, bone. You're doing all of this to try to have some semblance of a homeostatic system that doesn't blow back on the cells. And so when you create a cationic environment, it creates an agglomulation, a thickening of the fluid. And it's an already thickened fluid because it is a lipid fluid. So you can imagine when you notice a breast tumor or a tumor back, you've got pathways that you have to hydrate and get open so this can drain. The only reason you're forming it in the first place, like any other pimple or boil or anything like that, is that your lymph system can't carry it away. So since it can't carry it away, there's stagnation. It's going to form a holding tank, a closet. Like in your closet, you put things you don't want. That's what your body does. A tumor is a holding tank, a closet. It's a holding tank. And it holds until the pathway's open, and it'll open up and it'll let it go out just as nice as you please. But no, medical doctors are going to stab it, break it, pop it open so all this acid sludge is exploding through the body. And that seems to explode things. So detoxification is obvious. When you see what acids do, then we have to come on the other side of the fence, because all your symptomologies are predominant, not all, but predominantly on the acid side. We've got to get on the other side of chemistry. And when we do, you guys see the magic. You see the magic. When you understand what foods are designed for the human as opposed to for the elephants and horses, in other words, get away from veggie, and understand that we are a high order. We're a high order of being. Fruits, berries. That way you don't hurt anything. You pick and eat. Thank you, tree. Thank you, plant, for your love. I love it. Excellent. And that's what we're fighting. That's what we're all fighting. I don't care how big your tumor is. It's still blockages in the lymphatic system. You can't attack that. By attacking that, you kill most of the people you're treating. When 100 people go to an allopath, an oncologist, to get treated for cancer, an unknown, and only 6% of them survive, so that's 6 live out of 100, what do you think? Some problem in this? A huge problem in this, and we're complacent. Our governments are got complacent. This is a killing machine like no other. We don't do anything like that. Out of 100 people that come to us, maybe 1 will pass, not from us, from the fact they came too late. 1 or 2. What if we lost 5? That would give us 95% cure rate, which is about where we're at. And on anything but these large tumors and all this stuff, we're probably closer to 100. Unless you guys back up before you get done with it and freak out and things like that. But if you hold tight and you battle the cleansing and the hydration and all that, and the working back in consciousness of the cells, you'll have your remedy and you'll have your health back. And thousands of people are proving it right now because they're following the world of truth instead of propaganda and lies. Oh, we just found the lymph. You just found the lymph system? What is this, 21st century? You haven't even found it yet. They think it's an organ. They haven't even found it yet. It's like, well, the University of West Virginia did find the system in the brain, the lymph system in the brain. That should have propelled this a little more. And then the lymphatic system. However, I can't even imagine she named it the lymph. I can't even imagine that when they found the second lymphatic system in the brain, she thought it was the second one. See, first, that's what gets me. This professor claims that this was the second lymph system in the brain. That means she knew there was one, the main one. But they just found the main one 2.5 years ago, and the lymphatic system was found. See, so there is so much like, you guys are just not consistent. You guys there's just nothing that fits with you guys. I like things that fit like a glove. That way truth is for sure. Because if you don't live your life of truth, not a lot of fun. All right. So let me see. I don't know if I can show this. The client who released the tumor out of his bowels has started. Oh, I already showed you. All right, so the client that released the tumor out of his bowels has started spitting out bits of the tongue tumor. You're good, buddy. I'm telling you, man, you deserve a gold medal for this one. Holy crap. Look at this. This guy with a huge tongue tumor is now spitting out pieces of his tongue tumor. Yeah. Now see, when you don't mess with things, the body is trying to get it out. Remember, you ladies, notice when you get a hardness, it's moving toward the nipple. Notice how the tumors in your breast like to go toward the nipple. Why? I'm pulling a tumor. I was pulling a tumor with black salve the other day on a lady's spine. And actually made it like a pimple. And I just, ow, wow. That's what they're full of. Tonsil stones. Anybody ever had tonsils? That's what tumors are full of. This is sewage. These are proteins. That's why they stink. These are acids. And they just need to get out. Just like a pimple or a boil. Same thing. Same thing, guys. There's no mystery. There's only so many things in the human body. You got organs, you got glands, and you got 2 fluids to take care of them. Wow. I'm proud of this guy. Holy crap. Take a look at that. That ought to freak out his medical doctor for sure. Holy crap. Wow. Wow. See pics below of what is falling away from the tongue tumor. Damn. The great thing is the tumor on the tongue has decreased in size considerably. The bigger part of the tumor, which extended well and beyond the tongue, has now almost disappeared, and my tongue is flat. Yeah, baby! I feel for this guy. I feel for this guy. Anybody ever have pain in the tongue? You ever cut your tongue with a razor? Oh, no! Oh! God, I'm proud of this guy here. Good work, man. Should be, except with the hard lumps underneath the skin, you just keep going. You just let everything hydrate and loosen. Hydrate and loosen. That's all you can do. That's all you can do. You know, you can't treat this. You can't go after it. You can't burn it out. That's crazy. Then the person loses the tongue, dies eventually because everything, yeah. You can imagine what the allopathic community would have done with this man. There would have been no tongue, obviously, but probably half the throat gone. But the tongue itself has some hard lumps underneath the skin, and these are causing intense pain and have made, I know, intense pain. I know. Keep going. You do not stop. Try some anti-inflammatories in the mouth. Marshmallow, slippery elm. See if that'll help with a little bit of the pain. But when you get a tumor like that that's highly acidic, it's tough with the pain, brother. I tell you, you try the antispasmodic and a pain formula. Outside of that, you're going to have to grab something a little stiffer. I've been checking my acidity upon waking up in the morning using the pH strips, and upon waking up, my saliva came up with an 8.5 reading. Yeah! That's what you're talking about. You got to get up to that 8, 7.5, 8, 8.5. That'll help start breaking this stuff up a lot quicker. Sees the difference? In acids, things get agglomerated and thick and tight. In alkalinity, things loosen up and break up and go away. That's simple. All you young guys and gals, you're learning the truth. And when you go to school, you teach your friends this, so they understand this. This should be taught in school always. I have been also switching sodium bicarbonate. I don't blame you. I don't blame you putting bicarbonate. Anything to alkalize, because that'll help try to pull some of the pain away. The more alkaline the body is, the more pain-free it is, I can just say. Unless you get way up on the, but it's rare to get that high. Tumor bleeding after a few hours. Yeah, you know, it's probably going to have some bleeding. If you get too much bleeding, you're going to have to check that in some way. We have a bleeding formula that can check internal bleeding. There are herbs that will stop, even lobelia will stop internal bleeding. But you want some bleeding because that's how it cleans itself. Remember, blood is alkaline, and the condition is acidic. So that's actually why things bleed, and that's why. And when you look at how the Creator created, it's why you have 20% interstitial blood. And when you have trauma, then you have bleeding, and it helps to cool it down. And I mean, you just take a look at everything fits for everything. It's amazing. Who could come up with this stuff? I mean, to the nano levels, everything fits. I mean, that's why I'm a God lover, man. That's why I'm a God man, because there's nothing else like that. Just whoa. This is amazing to me. Yesterday I did it too, watching TV with my brothers, and I felt something fall into my throat, and I spit it out, and it was a dark red, blackish piece. Pretty cool, man. I love this. I just wanted to mention to Dr. Morse that we use a strong dosage of the Heal All capsules along with the rest of the protocol, which I think has helped to pull that large tumor out of the bowels. The Heal All capsules. I love Heal All capsules. I love my Heal All tea. I love that. They can take, douching with it for the ladies can convert atypical cells vaginally within a week. Convert back. Remember, you can convert cells that are being damaged by acids. You can convert them up to a certain point. I can't tell you that point. Probably a pathologist or a histologist, maybe. But there's a point because they don't see regeneration, right? Because they deal with people that are not like you guys. This is amazing, man. This is just amazing. I'm going to keep this up here for you. Wow, wow, wow. Wow, wow, wow. This is from Jennifer. I've been, what time is it? No. I didn't turn my clock up an hour. That has to be it. I've been growing facial and body hair all over, and it's just getting progressively worse. well, you might have a little imbalance in your steroids, no question. So you want to, to bring homeostasis or a balance to the body system, you have to eat balance. And some people think, well, I eat fruit, that's not a balanced food. It totally is a balanced. You got to remember that each species, each vertebrae has its own unique design in the GI tract, in its pancreatic issues, in its length of the GI tract, its absorptive issues. All types of differences exist between the frugivore, your herbivore, your omnivore, and then your carnivore. Each one of these slots are different. To put man in as a carnivore is insulting to not only all of us, but it's insulting to the Creator. We are far from omnivores. Most people eat like omnivores, but we're frugivores. We are a high species. A man needs to start loving himself and realizing, hey, I'm not bad. Look at what I can do in the human body. What you can do out of the human body is far greater. Cool stuff out there. So, to bring balance, you want to shift your diet and get yourself balanced. If you want to have fruit in the morning, a salad at lunch, and fruit at night, perfect. And that'll bring you into some degree of balance here. Work on the adrenal glands, of course, and try to bring your estrogen levels into balance with your testosterone. Because a lot of women now are having more testosterone, and of course that's giving them more male properties and more hair and everything else. They just bring a balance to the body there. The adrenals, the hormones are all over the place in people. So you just make things healthy, knowing that healthy tissue has its own consciousness, how to run itself. The human body is a self-running machine. But now we have fed it the fuel that has broken it down. Now we have to get a different gas station where we have raw living fuel, and that'll help to rebuild it up. That's all it is. Everybody's body needs to go into the body shop for a little while and get fixed up. I did a full hormone blood test and it came back normal. Yeah, right. This brings up a very good thing here. There was a female I had here, and I can't remember what it was. I think it was cortisol. And I told her, I said, I've seen a lot of endocrinologists who, when they do these tests, everything seems to be normal, right? So she went to the endocrinologist, and she was talking to him. He said, yeah, and no one has trouble with that, really. They all come back normal. And she goes, oh, yeah, maybe I better go. Because each steroid has its own properties and its own effect. We know a lot of that. We don't know it all, but we know a lot of that. So we do know that when something's out of balance, we know what's going to happen with that. And that's what gets me. Well, let's run a test. Do you really need to run a test? That shows that, and no offense, but your children that you're raising, you really need to teach them how to add and subtract in their mind, not on a calculator. Because when you start using calculators and then you're asked to do it without a calculator, it's like, see where I'm getting at? So if you're used to using tests to answer your questions, or you're used to looking at, you don't have any consciousness of your own. See, that's what gets me. Every practitioner needs to have their own awareness, their own consciousness. They need to be able to look at the human body, know exactly what's wrong when you see a symptom. You don't go, I've said this before, you don't go to a mechanic. When you get a noise in your motor, most of you don't want to go to a mechanic that goes, I don't know. Let me tear that up. Let me tear your motor apart. I'll find it. Or when you go to a mechanic, he goes, yeah, that's your alternator. We'll replace that and you'll be done. That's who I want to go to. Well, or let me run a test and let me, I'll see if I can find it. You don't need to do that. A true healer of the arts knows the human body and knows the lymphatic system now, because we've introduced, when did I introduce that? 20 years ago or more? So, we should be there. especially the naturopaths. But now the naturopaths are going down to Hellville instead of Wellville. And that's because a lot of the naturopathic schools, Southwest Michigan, particularly medically inclined, no, that puts them, and they're using the naturopathic word. It's just disgusting to me. But, sweetheart, bring your body into balance. Go work on your adrenal glands. I did take a blood test back in 2011 that said I had issues with my adrenals. Yeah, well, that blood test is probably a little more accurate. I would work on my adrenal glands, my dear one. That's where I see it. What herb should I take for idiopathic? Please help. I don't know what else to do. It's been causing me extreme depression and anxiety. That's your adrenals, sweetheart. Work with the endocrine gland formula. Also take note of what your blood pressure is. Check your blood pressure, both arms. Always check both arms. Because what's blood pressure? Why do I want to know blood pressure for? What does that tell me to look at blood pressure? If you ask most nurses, they might give you some kind of answer, but what's systolic? Top blood pressure number. What are we looking at? All right, so when you go up in your blood pressure cup, you're listening for that top number to stop. You're listening for the pulse to stop. A lot of nurses go up to 200. Yeah, I'd hurt the patient. No, if you're listening and you can move your stethoscope, you can listen, you can hear when your heart starts beating, and that's the top systolic number. Now, that is your what we call the cardiac punch. That's your neurotransmitter punch. That's your autonomic nervous system. That's neurotransmitters, right? So that's what we want to see. How strong is your autonomic nervous system? How strong is your heart? How strong is your neurotransmitters? When you see low blood pressure, everything is going low. Your energy is low, your adrenals are down, because this is directly the autonomic nervous system. So you bring down the autonomic nervous system, you can't breathe, you can't take a deep breath. That's all asthma, COPDs. They all have adrenal weaknesses. This affects the autonomic nervous system. That's how you move, your flexibility, how you everything. The worker bee, sympathetic, parasympathetic, the dualistic worker. Oh, I forget where I was. But the bottom number is your diastolic, kidneys. You do not want to have too low of diastolic, because that's kidney weakness. And of course, as the kidneys get inflamed and pressured up goes the diastolic. The systolic, I don't care what it is. The diastolic is the most important one, because you run up there high, you're not going to filter. You're actually building pressure back up toward the adrenals and in the system. And so, important to look at blood pressures. Adrenals on top of kidneys. That's just how you find it in the body. That's how we take it with the blood pressure. Systolic on top of diastolic, adrenals on top of kidneys. It gives you a good look. And you've got 2 kidneys and 2 adrenal glands. And you can tell which adrenal gland's lower. So my guess, sweetheart, Jennifer, you're going to find low blood pressure with this. It's a real strong probability that it takes you back to your adrenal glands again. Right? But I would work on the adrenals, use the endocrine gland formula. We have adrenal formula, but also work on the kidneys, work on the lymphatics. And when you're working, you go, girl, because take a picture of your eyes. What condition? Because if you have weak adrenals, they control the kidneys, which was the eliminative organs of what system? The new organ system they found. They haven't named it yet, have they? The lymphatic system. The new organ of the human body. I tell you what, when somebody has a realization that has any power at all, it should be, we've been messing up real bad. We've been hurting a lot of people because we didn't understand the lymphatic system. Wow. Is dry fasting safe for everyone? Someone who is hypoglycemic? Yeah. But I'll say you this. Watch that blood sugar, though. If you're too hypoglycemic and you notice that, when you dry fast, that should bring your sugars into a balance. If you do notice it going down, you're going to have to take a fruit with you. You're going to have to suck on a piece of fruit and work that way and just work the adrenals up. As a matter of fact, we're on the adrenal glands. We're back on the adrenal glands. Remember, your adrenal glands are heavily involved in the metabolism of chemistry. So if you're low in iron, everybody tries to get the liver, give you liver herbs and everything else. But how is iron utilized? Adrenal steroids. How is zinc utilized? Adrenal steroids. How is copper utilized? Oh, adrenal steroids. How is magnesium? Oh, adrenal steroids. How about calcium? No adrenal steroids here. Parathyroid hormone. Seems to be the only one. Could be more, who knows. But it seems to be the only one that needs that parathyroid hormone. Whether there's a steroid in conjunction with that, I don't know. But it's enough to say that most of your other minerals and your blood sugars, your blood chemistry, the food chemistry is very dependent on adrenal gland health. So when we get to the fact that your body is a food processor, a chemical processor, chemistry processor, then the third stage of this is what? Utilization. And everybody has adrenal weakness. So you're going to have some deficiencies from the fact that you have low adrenal steroids. So it comes back to the adrenal glands again, working on and blood sugars, hypo or hyperglycemia, which is diabetes up at the top end. Both are the same gland. Matter of fact, and I've said this before, there's not a type 1 that does not also have the adrenals involved. I've never seen a type 1 that also did not have the metabolism side of this involved. How that relates, one would have to put a lot of awareness and pulling in from the divine to look at that. And you can do that. Love you too. You guys are good. You guys are so good. I mean, in time it'd be like talking to a bunch of practitioners. You guys will be working on cases after cases because we have them. We have Jonathan, we have Shane, we have all kinds of people out there working. And I just love it. Putting that extended hand of love out and saying, let me help you. I found the truth and now I'm going to give it to you. Okay. I'm going to have to break for lunch, but I'm coming back and digging into this pile. Let me do one more, though. The dog has passed away, but she would still like you to discuss keto. Oh, wow. Diet with dogs, please. Absolutely. You know what? I have an issue. I would be grateful if you could get some clarification from Dr. Morse. My dog has cancer. I detoxed him and the tumor came out onto the skin. My holistic vet said it would be best to take it off as it was bleeding profusely. He had him on the keto diet, keto pet. Wow! Scrutiny in U.S. say cancer dogs and put them on the diet with great results. They made up his diet plan. Okay. After the op, I don't know why you just didn't pull it off. Well, if it was bleeding profusely, of course we have herbs that stops bleeding like that. But if you can't, and I'm sure he has an anticoagulant, I'm sure he has something like that. You could have used Baxad and popped that baby off. But my doggie was doing really well, no sign of a tumor, and had more energy than he had in a while. I was watching one of Dr. Morse's YouTubes on the ketogenic diet being not good, so I stopped feeding my dog it and went back to just raw meat and veggies. I also ordered some herbs for him. Within a week, the tumor was back, really, and 2 weeks there were more tumors around his neck. Well, I needed to go to the kidneys. This is all dogs have the kidney failures. We talked about that. When the herbs arrived, he had already stopped eating. Oh, he is now dying. Yeah. Apart from being utterly heartbroken, I am so confused about the keto diet now. I have my cancer patients who are on it. I usually switch them to the fruits, berries, and melons and herbs. But now I feel this confusion about it. I would be so grateful if you could get some clarification from me. Oh, look at this, sweetie. Look at that, sweetie. Well, we talked about the ketogenic. Let me take a break for lunch and I'll come back and talk about this because I had a golden retriever myself and just so sweet and beautiful. But it is true that canines, universally, all of them, have kidney weakness. And they all fight the lymphatic system. That's why you see them all get the cholesterols, they all get the cataracts, they all get the humps and bumps, they get the hip dysplasia. This is all acidosis. And that's part of the problem. The ketogenic diet is more of a lipid-based diet, which is suppressive to that, suppressive to acids. But to have this happen when you stop the ketogenic diet and to see that explosion, that meant that that diet that the vet had him on was suppressive. It wasn't detoxing. And when you have a tumor, you have to detox that. You have to get the kidneys to filter. In dogs, horses, I don't care what animals you're talking about, you have the same systems and the same problems arising. And the problem with dogs, omnivores, we feed them too much protein. If you go into the dog store, everything is protein, high protein this. You're starting to learn, this is why I mentioned the rabbit doo-doo. Pre-digested proteins or amino acids. Because we feed our dogs all these dog foods and dog treats, and everybody has this ridiculous idea that omnivores need all this protein, and they're closer to humans. Look at we said this before about the grizzly bear and the black bear. These are low protein eaters, and man just has an opposite view of this. But in factual is not. Black bears factually are very low meat eaters, and factually the grizzly bears, Discovery Channel did a whole story on them. And it factually came out that only 7% of the older bears or the adult bears actually had 7% protein in their diets. That's not much. So we do feed our dogs too much protein. So when you see that and you stop feeding them and you went back to feeding the dogs fruits and stuff, this is what cleans the body out. But that's obvious the dog was in kidney failure. It's why the tumor's in the first place. But it is really on my mind too, and I want to think about this a little more than that, because that's highly suggestive that this diet had highly suppressive effects to the lymph system. Because you can't just take a dog off of this and a few weeks later see tumors popping up all over the place. From where? From where? So that tells you that the program that, or whatever else that the vet had him on, was suppressive to the lymph system, wasn't creating filtration and things from the kidneys to get the lymph system filtering. And that's what you have to look at, is because I don't know any other reason for that. You can't suddenly have a tumor come out on one diet and then you stop the diet and in a few days later or a week later, then it's tumors all over the place and things like that. There had to be something very suppressive to that, as far as I'm concerned. Because when you look up at the ketogenic diet and you look up at some of these, got some very acidic backlashes and some toxicity effects on you. So I don't know. It's tough. I don't know. Sad thing though. Nice dog. But the herbs and the diet are a big deal. Getting the dogs to filter and clean the tumors out, because we do dogs with cancer all the time and never have any problems. So I don't know. It's just like, it makes me wonder too. It really does. It makes me really wonder, because and humans, I don't like the ketogenic diet at all. We see humans don't do well on it. I mean, you see them, it's an anti-inflammatory diet. I'll put it that way. It's more of an anti-inflammatory diet. When you get it and tear it up, and I forget now, but I read you the whole ketogenic thing, and you can make up your minds for that. But not a diet for the Homo sapien, put it that way. And it's not obviously a diet for the rest of the species. You're talking about a high lipid diet, but I don't know. Had to be suppressive though. When you see tumors just explode in someone, that means something's been suppressing. Reminds me of chemotherapy and stuff. And you have to ask if your vet, even a holistic, didn't give him something. Because when you suppress the lymph system and you don't work on elimination, this is what you see, it's the blowback. Generally, when you do chemotherapy and they tell you're in remission, you get excited and things like that, but we call it the residual kick. And, it can blow back and then explode in you. Tumors popping up all over the place and stuff like that. So that's what that reminds me of. We don't have that effect when we do it the right way. When we open up the kidney channels and open up the body and we do it that way, we don't have blowbacks. Blowbacks come when you suppress, kind of like steroids suppressing. So maybe gave the dog some steroid stuff or whatever. I don't know. Don't know. Be interesting. We'll look at it though. But sad stuff, when you have to lose a good pet like that. But for all those that have canines, you've got to work on the kidneys. This is a universal problem, and it's causing a lot of poor problems in pets from the cataracts and stuff, where the pets are going blind, and the arthritises. But remember, the pets, they don't have sweat. They don't have the ability to eliminate through the skin. That's why they pant and why they have nose and mouth elimination. So it's compromised when you look at that. So it's interesting. Feeding dogs and things like that. Cats different, but feeding a dog a high protein diet is assuring of walking them into cancers and blindness and everything else. But that's our society. And now Purina is taking the grains out, so it shows you that the grains were acidic and toxic to animals, because grains aren't normal to life. So where does that bring us? Back to pre-digested protein. Look at your dogs when they get out. They love to eat grass. Not really conducive to an omnivore, but they need that nutrition and stuff, But I don't know what to say. But I'll be back as soon as I can run to lunch. I've got to have a little meeting, and then I want to finish this video up this afternoon. All right. Thank you so much. Back. We were talking about this lady's poor dog here, and I was thinking at lunch that, remember that the fruits and the berries are astringent. It's what we use them for. They feed, energize, heal, and clean. And they do more than that. When you pass a certain level of work on the body, you got malabsorption fixed, you have digestion fixed, you have utilization, the adrenals fixed, and you've got everything working well, you start becoming more powerful physically in every way, shape, or form. Your muscles, and I was talking about this the other day, your muscles start having power that you've never felt in them before. Not a fakey, I eat high protein. No. This is a power of the universe. It's hard to describe it. And I'm sure some of you are starting to feel that now. And it's just hard to describe. Your muscle in half the size becomes twice as strong. It's just amazing. What weakens are acids, see? And the more acidic is a catch-22, because as you strengthen this way with the proteins, they turn around and break you down. And so it's an illusionary concept to build up on proteins, and the next thing you know, you're in RA or you're in some type of arthritic type of issue because the proteins were sucking. And I've seen bodybuilders with joints way out here, the wrist gone, stuff like that. Not worth it for a few years of whatever to have your life ruined and in pain. And if you don't find someone like us, you're just not gonna, you're gonna have a life of pain and steroids and everything else, and then there goes your adrenals and everything else. So it's possible that, of course, the ketogenic diet, I want you to think about this, actually is a more ketonish diet. And I don't care any of you out there, ketones, ketoacidosis, it all is the same stuff. I don't care what you think. Look it up. And so this type of diet creates acidosis. So you don't want to create a diet with like too many lipids and you get too many ketones, because it all ends up ketoacidosis. So it's possible that whatever, the vet could have even given this animal some steroids and her not knowing it, but whatever, something's suppressed, because when you start giving someone fruit, they're going to start cleaning. Well, the kidneys are the channel. And remember, this dog has probably lost kidney filtration big time. That's why you have a tumor in the first place. You can't get a tumor if you're filtering. You would have to be a constant milk drinker, I would think, to get a tumor when the kidneys are filtering. So it's obviously the dog's kidneys weren't filtering, and with the fruit being a little more aggressive on the lymph system. In the same application, I want you to think about when you have a client or yourself, you've got tumors, and you take off on this detox program. If you hit the lymphatic system with lymphatic herbs too hard, your tumors can grow, can expand, because you're trying to pull on a system that has blockages to it. And that's the whole understanding of what man's problem is. They have a blockage, and the blockage is right at the doorway out, right at the kidneys. Now the skin also is the largest kidney you have, right? What could affect the ability of the body to eliminate through the skin. Body temperatures. So you would look at what? The thyroid gland and its connection to the metabolism and heat production. And then you could see whether the skin was eliminating as well. Well, on an omnivore, you don't have elimination through the skin. So that compromises that. And so there's only certain foods that these animals can have not to create, acidosis, which then in turn creates mucus and congestion. Same thing. So I would say that that's true of humans as well. We try to be real careful first when we hit the lymph system because we're not sure. I went from 2 lymphatic formulas initially down to 1 because of just, the kidneys are more in our face than ever before, that they don't filter, and people are, every day we're getting calls and calls about kidney functions down to 10% or 8% or, it's kidney failure after kidney failure after kidney failure. And that's what you're seeing. Well, when you get your blood work and your creatinine is 0.7, let's say, 0.6, you're starting to creep. 0.7, you're on your way. 0.8, you're getting in trouble. When you hit 1, some labs, 1's normal. 0.99 in most labs have always been normal, and that's twice as high as it should be. But they don't understand norms in proper kidney function. When you get your cells real healthy, just have a blood workup and look at your BUN, your urea nitrogens. It'll always be around 4 low, and your creatinine could be marked low, 4 or 0.4 or 0.5. It shows you that stats are not based upon healthy people. And the problem is, it's hard to find a healthy person, truly healthy person. People say, I got stamina, I work hard, and I'm healthy. Yeah, right. Let's peel off the skin. Let's take a look inside, baby. Ooh, no, yeah. So it's sad when you have to lose a loved one like that, but it's a lesson, and I think us with dogs need to have our dogs on kidney formulas regularly and just realize, and the problem is treats. All these treats, even the Paul Newman's treats, all these treats are high proteins. And that's just a major misunderstanding. Like I said, let's start getting a rabbit production up and sell rabbit doo-doo. Dogs love it. It doesn't create pancreatitis or hepatitis or any of those things. So I don't know. All right, let me see here. Message, hi. I have recently gotten my allergies tested because of chronic breakouts on my face and body, right? It came back that I have a fruit intolerance. How do I heal this intolerance when I am so limited in only eating melons and tomatoes for fruit? It's amazing that you can eat tomatoes, my dear one, because tomatoes are highly acidic, the nightshades. Will I ever be able to overcome this fruit intolerance, and if so, how? Well, number one, these allergies, I don't know how to start with that one, because people put so much faith and so much trust into all this bull crap that you hear, allergy tests and all this crap like this. I get it. You have to understand that when you go on fruit, it's going to start bumping what system? The lymphatic system, right? That is your allergy system. Blood isn't your allergy system. The lymphatic system is. And when you start getting allergic to anything, you have too much in you of that, like sulfa drugs and things like this. All the people that are allergic to sulfa drugs and things like that, they have too much in them. And when your cup runneth over, and I mean your lymphatic cup runneth over, then you become allergic to everything. But you can't let that stop you with the fruit. Fruit is going to create a cold and flu-like scenario in your case. It's going to create an allergy breakout. It's time people understand that when you start having allergy-type symptoms, your lymph system is a mess. And if you don't start opening it up, you're walking down to Hellville. And you got to fix it. You don't try to avoid the foods like the foods that's going to make you well. I can't have the foods that make me well because they have an intolerance. It's like throw that away and head down the road. Get on fruits, berries, melons. You can get on the less astringent fruits. That'll be better for your allergy symptoms because, again, it's just like anybody with psoriasis or eczema like on your face. When you start detoxing, we all know it's going to look worse before it gets better because most people have used suppressive agents, including chemical steroids, to suppress this, thinking that, because medical doctors, remember, they can't cure, but they treat. When you treat, you don't cure. It's that simple. You cure only when you address the cause of the problem. So when you chase the rainbows of treatments and testing and things like that, you never win. Because you're under, well, I can't do anything, I've got the MFG. I can't detox because this medical doctor I had said that mother gene. Are you kidding me? You guys got to wake up and realize the joke they're playing is on us. And we are not going to take it anymore. So, you got to, sometimes you have to push through just like the skin thing. Sometimes you have to push through it. It's not like an anaphylactic shock. There's a difference, guys, between an anaphylactic, that, and an allergy reaction where you get some rashes and maybe some hives and things like that. That is even more so you got to detox, more so. Or you'll end up like the little boy in the bubble where you can't interface with life at all. That's why most babies that are born need to go work on live on the farm for the first 5-6 years of their lives, develop an incredible immunity, and then they can deal with it. But city slickers and concrete cities, you don't develop much of immunity like that. So, and of course the diets are atrocious, and no good country food as a rule. So city slickers have a lot more problems. City slickers. But, and then just eat melons then. But you want to get on the herbs. And if you have extreme allergy reactions, I would muscle test all the formulas. If you feel you might be allergic to any herb in these formulas, you muscle test these formulas on yourself because you don't want to go into an anaphylactic shock. I've only had that happen maybe twice in my entire career. And one lady, it was on, it was the circulation formula, and it was horse chestnut. She was allergic to horse chestnut. And about 20 years ago, I mean, I remember that one, but and so, but I had no idea. And if you're allergic to something, read the labels. But muscle test you, it's a simple way to do that. But you have to allow your body to detox when you have skin problems and allergy problems. And if you can't push through it, you're going to suffer the rest of your life. And it doesn't get better either. It gets worse. Why? Because all your cells are constantly in production of systemic waste. And where do these wastes go? Well, if your kidneys are not filtering and you with psoriasis and eczema, you're not filtering through the skin, nowhere. Your acids are going nowhere. They're staying home, and you don't want those kind of relatives to stay home. Those are acids. Those are the relatives that hurt. And there's only one way to get rid of them. You can't throw more chemicals into the body to try to treat it. This is systemic waste that has to simply get out of the body. And imagine all the money, the hours, the destruction of animals, the destruction of humans, all around the allopathic thinking, allopathic theories, which can't be proved in labs anymore. And they're just having a real hard time verifying the validity of their thinking. And you guys are verifying the validity of the Creator because you're using all the tools the Creator, including the diets of food. You're understanding the proper food designed for man, and you're applying that to your health. And of course, when you do that, your body starts fixing itself. Yeah, the road to Wellville is a little hellish sometimes, because you have some pain and up and down, because you have cells holding memory pain. And wait till you hit the emotional detoxes. On the spiritual side, you have emotional detoxes. Now, this is your astral body detoxing. That's going to be tied to what glands? The adrenal glands. So as your adrenal glands detox, so is your emotions. You could go higher in anxiety. You could start just crying for no reason. All these things. And always, no matter what, guys, no matter what you're facing in your struggles to become awake and aware, you are always the living truth. Remember what Jesus said. You are the living truth. He was the living truth. All things are the living truth, because all things are within the body of God. Remember Christianity, omnipotent, omnipresent, and omniscient. Okay, so we'll be heavy. Oh, it's just okay. Oh, look at this. I am a French naturopath. I absolutely search on information for my working graduation. You know, European naturopaths understand a lot more about raw foods, I think, and more about detoxification by far than Americans. Americans, they have been taught to be stiff, pompous, and straight. Look, we wear ties and suits. I haven't wore a tie in 100 years. Give or take a few. Ugh! Robes, something comfortable. You know, but we don't want to become. We want to be pompous. We want to be rectal. We want to be, I don't know what we want to be. We want to regulate. We want to control. And that's not freedom. This country lost its ability to have freedom. Become socialistic. Okay, I'm a French naturopath. I absolutely search for information for my working graduation. I am sure that you have this information. I have not found it in your tools. If you want to be an incredible naturopath, you follow these the tools we're showing you, and my friend, you will be a very well-respected naturopath, because our YouTubers with no education whatsoever are curing everything out there. So, you know what I mean? Ooh, hurt. I've always said this. All you mamas, all you females are really the naturopaths. You are the true healers. You're the divine ones. And it's up to you to learn how to not only get yourselves healthy, but your babies and then the old man or whoever, get them healthy. Because you're the you know, women don't realize they're the main vortex of this God energy. They're the ones that show us love and compassion and understanding. Men are just, you have to have a lot of feminine in you as a male to balance that out a little bit. Now, I have found in your tools, it concerns the simulation of fructose. Are there two paths? Okay, one path is that fructose is transformed into glucose by the liver. Ask yourself, my dear man, why you would take a superior simple sugar and convert it to an inferior simple sugar. Or why a simple sugar, which is as simple as you can get, be converted to another simple sugar? Don't make sense, does it? Because it's a lie. Doesn't happen. Does not happen. No way. And you can see that. And you can demonstrate. If you're a naturopath, put your type 1s all on a fruit diet. First week or so, they might glucose load, especially if they're real sensitive, brittle, so to speak. But it won't take long, and their blood sugars will normalize somewhere about 100, 150. That's pretty good, down from 5, 6, 700, stuff like that. On fruit. Well, wait a minute, fructose. As a naturopath, your job is to teach the world why fructose is good for you. Not the bull crap that's out there, the lies that are out there. Remember, the negative forces do not want humans to have the food that is designed for them, because it will increase their spirituality. You know, you start eating, look at it, all you got, bunches of you are telling me how open you're getting, how awake you're getting. Yeah, and many of you commented the fruits are the triggering mechanisms. Cool stuff, huh? So naturally, you're going to have the negative forces not want you to consume them because they want to control and own you. It's just the duality of it all. I mean, you have to look at it's a game. But a lot of souls get trapped in the game for longer than they should. So now you see a bunch of masters here as a collector of souls, so to speak. In other words, they want to awaken you so you can now advance into some higher levels and make this level a little higher level to experience. You know, your guys are introducing, I've said this before, new levels of awareness to this planet. The lower levels are going to fight, yeah, too bad. But the high levels is what this planet needs. Humans need to wake up to their beauty. And the beauty that the Homo sapien can demonstrate. And it has not done that yet. And it really can. So, with all your help, but I am sure there is a second one. One, direct absorption is absolutely, and no insulin needed. That's a neat thing about, and that's why you see that. And you see that demonstrated when you use type 1s. Because glucose is just that a little inferior, simple sugar still. Can't get any simpler, right? Unless you start breaking down now you're going to break down the atomic structure of it, right? So really, we're at the simplest component we can get. And there's only 3 simple sugars, and there's ribose, there's all kinds of other simple sugars. But the ones we know of in foods, basically, that we talk about, is, of course, your galactose in milk, your glucose in vegetables, and your fructose in fruit. Okay? Just kind of makes sense, don't it? That different varieties of food have different types of chemistry in it, depending on its energetic nature, its utilization nature, the type of species it's for, and the design of the species to match the design of the food. I mean, the creator, and we're trying to second guess all that? Not me. Not me. No way. Are you kidding? You have to understand in allopathic and in research, things are not happening like you think they're happening. Stem cell, all this stuff. You might hear one little thing here, one little thing there, but I will be so great to have your response. Also, I know you are so busy. Sorry for that. It's so important. No, this is a good question. It's a question we've talked about before, but it's a valid point. You can test that out when you look at, like I say, type 1 is the best way to test that out. But just common sense. You know, sometimes you have to understand that Patton's a good example of that. Remember, she's an anatomy physiology professor of 15 years, a biochemistry teacher, and a medical doctor, all 3. And she was saying about every week there's something new. They discover something they had discovered that's not quite true, and now they found the real truth of it. You're finding the new organ, the lymph system. You see what I'm saying? So pull back and let God educate you instead of man's books and man's ideas, because he's struggling along with theories that are killing a lot of people. You want to pull back and look at how God put it all together. Get it out of your own awareness, because what you don't understand is the answers are in you. The answers are not outside of you. The answers are in you. You're from the Godhead. You're God individualized. You're from that. Remember, Christians, omnipotent, omnipresent, omniscient, think or view that and understand when you say that what that means. And as the fight right now with the Pope, there is no hell, he's right on. Of course, he's arguing now, I didn't say it, but he's right on. There is no hell. There's the negative and the positive. Things can get real negative and really bad, no question, but there's also the positive, and you can choose to go either way anytime you so choose. It's just 2 sides of the same coin, one being positive and one being negative, one being beautiful, one being ugly maybe, however you wish to look at that. And Christianity is going through that right now with the Pope, and I wish he would stand up and be truthful, because that would blow Christianity nuts. It would pull it back to Jesus' original teachings and become more agnostic, which is more in line with the rest of the world in terms of the Eastern religions of consciousness and that sort of thing. Because you can't deny, if you get into the other Gospels, not just Matthew, Mark, Luke, and John, but you get into the other 23 Gospels, and then you get into the Essenes and agnostics, you pretty much see what's going on here and how man has been hidden from the truth. And you have to be careful as a soul to get caught into some of these churches and things that become very ritualistic and control your freedom. Some of you are going to these churches that have a lot of questions that can't be answered. Look in other places. Maybe it's your time to graduate from one level to another. There's graduation, there's levels. Maybe it's your time to graduate. So there's always changing in allopathic thinking. You want the answers of life directly. You don't want to read, how'd somebody else get that answer? Right? Through experiences. But also experiences are from the physical. Remember, the physical experience is only a very physical experience. Your mind is the mental experience you're having physically is not physical. When you're thinking and using your mind, you're in the mental worlds, guys. When you're feeling your emotions and stuff, you're in the astral world. You're using your astral body. You're not using, physical body has no emotions to it. Your brain has no thought pattern to it. And that's the illusion, the grand illusion of this world. And once you guys start pulling back and not thinking so much and start observing, answers will come to you. And when you start learning how to ask the questions and just be there for the answer, it'll come to you. The more now you get, the more in the total now you get, the flood of answers, the flood of awareness of how things are put together. You get to see, because you're looking from above at all things, you get to see how things are working. That's how you get truth. You don't get truth reading a book or someone else's experiences. It's nice to see what they experience and take what you can on that, no question. I love books. But if you're relying on a book and you can't rip it from your hands and that's the word, you're in trouble. Because you're the living truth. And in that living truth is all the answers to everything, guys. So, don't cut yourself short. Each and every one of you hold the mystery of life within yourselves. Quit thinking and chasing your thoughts outwardly, just like quit suppressing inwardly in the physical body that which needs to be expectorated outwardly. And vice versa spiritually. There's an old saying in spirituality, you must go in to get out. And it's simply that you're trying to pull back from the five senses that's keeping your attention tied to this physical world. When you go into meditation, prayer, contemplation, you're pulling back from that. Well, who's pulling back from what? You are pulling back and becoming more of who you are. You're quit looking so much, and now you're beginning to understand, who am I? Because you don't know who you are if you're chasing your thoughts and emotions. Your time is consumed in your thinking and in your desires and in your planning and in your journey and your life. Very few take the time to go in and go, who am I anyway? Jesus did, Buddha did, a lot of people do. And a lot of you guys have done it and found the truth. And I just love you guys for that. Our whole field is going more and more into the spiritual side, and I've said this before. I'm just cleaning up the physical, getting it down. Our staff has got it down so well. Now we can move on. Because growth spiritually has its ups and downs. And sometimes you're put in situations. We just have a dear friend, and she was just put in a situation where they put her into nothingness, literally nothingness. Extreme fear, panic, because there's nothing there. That is the great divide you hear. That is the divide from thought, mind, self-identification to consciousness. And because there's no thing that you're involved in. You're just being. It's the simplest thing to understand and the most difficult to do because the bodies require attention. Your mind wants to think. That's what it's created for. Your emotions wants to feel and be loved. I get that. But you have the ability to choose what you want to experience, especially when you wake up. And so, if you want to be emotional, but learn how to pull back from it and go, I was emotional, now I'm free from it. I cried, now I'm over it. Be in the now. I am such a follower of you. Oh, you on YouTube, thank you. Such inspiring stuff. I have breast cancer in one breast, but because I live in New Zealand and able to visit or purchase your herbs, New Zealand, I buy New Zealand stuff. They don't want our stuff. Sad stuff because I love New Zealand, but I don't like what they've done. It's not fair, I don't think. I have kept it at bay for 4 years. Oh, God, honey. I'm glad you kept it at bay, but I don't like that. I don't like keeping... I'm proud of you that you've done that. Let me get that out of there. But let's go ahead and get you done, all right? Even if you have to leave the country for a little while. Go to Costa Rica. There's some guys down there, a nice healing center down there, kind of. Go to some place where you can spend some time and get into the herbs and get into the diet, or get the herbs, somehow get them got to you. There's other ways to get the herbs, I think. I don't know if Rohan can get into New Zealand, but there's ways to get our herbs in the countries that won't let us ship directly. And we have distributors over there that are distributing our herbs in places we can't get them. So I try that. And if you can't, try to find herbs for kidneys, the lymph system, which is the most difficult to find herbs for, the glands, and really tear after that. You want to get on a grape fast, grape and lemon fasting. Do it to dry fasting. Make sure you're filtering. See what New Zealand offers for herbal products. Maybe there's some good companies in New Zealand that make fine products. You want at least 1 to 5 concentrate. If you don't have 1 to 5 concentrate, the herbal products are kind of sucky. 1 to 5 is really a minimum level. Ours is 1 to 4. So, and I've told you that before. You can't get 1 to 4 out there without paying a lot of extra money. You'll never get 1 to 4 anywhere unless you have them specially made for you, which we do. You're going to get. Matter of fact, I was saying the other day that Nature's Way was 1 to 7. That's almost water in my opinion. Sorry. How you going to demonstrate the power of botanicals and of God when you water everything down and you're just about the money? I hate people that come in our field that are about the money, because our field is more of a spiritual field. We're about truth and justice and love and all of that. Not anymore, it seems like. Thank you for your wonderful, encouraging posts on YouTube. Hope so, because we can do it. You can do it. We can do it together, and we don't leave nobody alone. You are truly blessing to you all. Thank you so much, Vidya. Thank you so much. Vida? V-I-D-A, Vida? Well, let's get her done. We're going to get that breast done, because I tell you what, letting things sit, remember, every day your cells are continuing to discharge waste. Every day you produce byproducts and waste. That's your lymph system. That's your sewer system. And all these are sewer clots. Like the guy that just pooped out a big sewer clot. That's amazing. And breaking out of his tongue. Cool stuff. Love it. Hi, lovely people. Hello. I'm looking to get my 8 amalgam fillings removed. Good deal. And have some questions about how to go about it the best way. I will be doing a grape juice fast with herbs catered to getting digestion and elimination and the endocrine gland system going. Absolutely. Would you suggest having the fillings removed before, during, or after the fast? You know what? Either way. Because I think you should be cleaning in the process, and then after they pull them out and replace them, you want to detox. And that's when you want to do the most aggressive detox, because they've probably been leaching already anyway. So you want to get the head detox and get the mercury out of the gum, but generally they got it out of the brain, and it's a neural toxin. So neural toxins are a little more difficult. So use upper circ, brain, and nerve to strengthen the neurons. Strong cells, weak cells, So, that's the problem. Strengthen. 2 things reflect health. Clean and strengthen. Don't suppress. And what else can we say? Clean and strengthen. And you'll always. But anytime you have a procedure, you want to go raw after that 100%. And if anything, of course, it's not like it's tissue. There's no question, teeth or cells. But you want to think, how's my parathyroid? Is my pituitary involved at all? I want to strengthen because I had cavities, so I want to clean the gums of all the acids so I don't have cavities, and I want to strengthen. So you look at parathyroid, remember calcium utilization. The Ultimate Immune Formula has an incredible regenerative herbs, ginseng, antler. So there's the beauty of nature and the beauty of botanicals is you have goodies for all kinds of things. Goodies that doesn't hurt you. Yeah, there's toxic herbs. I mean, there's toxic roots. Look at poke and bloodroot. You do too many of those. Remember the guy that did too much poke root, about ended up in the ER with it? Yeah. I have a fond respect for botanicals because my hair wasn't gray until I was poisoned on quinine, and then it turned white. I mean, I got really kicked on that one. So I respect botanicals quite a bit, and I've seen what they can do. Amazing, amazing. When your focus is proper, it's amazing. Hey, Lori. Hi, I know Dr. Morse has talked about underdeveloped and sagging breasts, but does that also go along with the shape of them? You know, I often wonder about genetics and shapes and stuff like that, you know, and looking at your mom and looking at, and to see, you know, about shapes and stuff like that. Everything is in consciousness like that, and it's amazing. You wouldn't think chemistry would have shapes and sizes and all kinds of things. Isn't it cool? I mean, it's cool when you look at how the body was made and all these things. Okay, so remember when you start sagging or wrinkling, we're going to go to connective tissue, right? Connective tissue, parathyroid, and if you're short or tall, pituitary. Look at your eye. Best thing, snap, 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 snap. Parathyroid. Looking right. Oh, I got a pituitary that goes with it. I need to hit that too. Right? So those are the sort of things you want to think about in terms of toning and tightening, because this goes with everything else. You want to keep yourself toned and tightened. You know, the difference between a lot of the children that were raised, let's say, on farms and worked since they were babies, and those that were basically not in that position, moosh. And if you're malabsorbed, you don't have a chance to really develop strong, good muscle. You develop your moosh. Flabby butt, flabby breast, flabby, flabby, flabby. I don't like flabby. Tone, tighten. Well, you got two things to think about, muscles and connective tissue. Well, if you're malabsorbed, you're failing to get the nutrition that you need, and mostly you just put on fat then. And so, opening these doorways and getting into the raw and getting into the detox will tone, tighten, strengthen. That's what you're looking for. Now, still best draw. Pretty sure adrenals, because then you never hear cholesterol talked about pituitary. That controls breast shape and size, particularly size. So when a woman has too much cholesterol, she can get very large. Sadly so. And the other is true, underdeveloped. Now, with the female reproductive formula, when I first introduced that, we noticed that women's breasts, when they were smaller, were growing but getting firm. We had so many calls from Portugal. That's when I started working a lot in Portugal, and the ladies would go, I don't want my breasts bigger, and they're getting bigger. And I'm thinking, are they getting bigger, or are they toning and tightening? Because the formula isn't a stimulating formula, as far as I know. The female reproductive is a tonic that tones and strengthens the uteri and ovaries and whatever. So I don't know, but you want to go down this pathway to well-being because it tones and it tightens and it strengthens. And that's the name of the game, isn't it? You don't want to be flabby. If you're flabby, take a look at your eyes. 9 times out of 10, you'll be malabsorbed. You want to turn this around. You know, get your amino-rich foods, which is your fruits, berries, melons, and your vegetables are very amino-rich. But you have to be able to utilize. It is not how much chemistry you consume. It's the utilization of the chemistry you consume. As we're talking about on the video about orangutans being frugivores. And if this was true, my dear naturopaths from France, the orangutans would be a very sick species because they're exclusively frugivores. They all are. All the primates are, but they're stuck in places where they can't be. I would be afraid of a silverback gorilla on fruit. Peaceful, thank God, because fruit makes you peaceful. Thank God vegetables too. But you take an ape from a vegetable diet and put them on a fruit diet, watch out. Because the power of that animal will be doubled. The energy from not double, but an energy from a vegetable to a fruit is what? Is fourth as much or more? Say 9,000 angstrom versus 12? Or 8 versus 12 or something? So about a quarter, much more power. And I mean, that's power, that's energy. Power to the muscles, power to the whatever. Power to thought, power to awareness, power to everything. And remember, energy is consciousness. Wild stuff out here, fun stuff. All right. Mine are wide set and bottom heavy, but are they, all right, fiber cystic at all? Here, that's another thing. You want to be careful about getting too dense, because if your breasts get dense, that right there, here's a couple things. Dense breasts and painful during menses. You don't want those things. Those two things, where are you walking? Breast cancer, or what they call cancer, breast tumors, because that's the wake-up call. Pain during menses, a little estrogen causes pain. That means a little more acid, and not a hot one, causes pain to the weakened, more inflamed areas. Right? So wherever you have weaknesses or inflammation, and you consume an acid, whether it's natural estrogen or can create a painful situation in that area, like chemotherapy and stuff like that. Of course, the dense breast shows the lymph system isn't moving well through it. Heavier down at the bottom, I don't know what to say about that. You know, it might be getting dense down there. Remember, things kind of collect toward the nipple. I mean, it's just kind of like the sewage works itself to the skin so you can pop it out. And any decent tumor works up so you can pop it out unless you're suppressing it. It's like the guys falling off the tongue and stuff like this. The deeper ones, of course, don't work themselves out real easy. Although I have pulled a tumor out of the liver before, right from the back. Right from the back. But will fixing my adrenals plus pituitary and take the female... Now, taking the female reproductive is very smart. You're smart about the pituitary. Fixing adrenals is very important, but I'm going to throw another one in here, parathyroid gland, honey. Tone, connective tissue, tone, tighten. And this will keep you wrinkle-free and everything else. You know, they go into these plastic surgeries. They're like, come on, man, don't do that, because you haven't fixed the problem. You have not fixed the problem. The surgery... excuse me. The surgery then can develop problems. See, that's the problem. We generally have to do surgeries when we're highly acidic. That means the possibility of surgeries not taking right or getting adhesions and heavy scar tissue is high on the list. Remember, the more acidic you are, the weaker you are. So your body develops adhesions or scar tissue. What is that? I got to hold this tissue in place. So, you know, there was a rip in my skin, and it's not going to happen again. I'm going to double heal this, like a bone fracture. You'll find after a while there's more bone than you need around that fracture. Coast is clear, the body sucks that off, and it looks like a regular bone again. The body will overcompensate because it says, that can't happen to me. I'm going to overcompensate and fix this. But the problem is scar tissue and adhesions can be pretty gnarly, especially when you're having like a hysterectomy or something, and now you're dealing with abdominally, and you've got intestines and those sort of things that can be wrapped. You know, kind of like a lasso. All right, I got a hold over here, let's throw one over. See? So when you're weak, so always when you're facing surgery, you want to pump on the raw foods big time before, during, and after. And a long time after, so hopefully the scarring will be minimal. Female reproductive formula, good take. Although it should firm them, not make them bigger. Also a connective tissue problem. That's what I'm thinking. Absolutely. You guys are getting so smart, my God. You know, pretty soon there won't be any need for any healers, because you guys will all be healers yourselves. That's pretty cool. But the women should be anyway. I really believe that. I also want my breast to be healthy. Exactly. You know, guys, and forgive me for showing this because I do it a lot, but when you look at this, my heart hit the floor for this lady. Oh, all right, that's a breast tumor. I want my breast to be healthy. Right on, lady. And you want to always have that, all you ladies. This is a nightmare what's going on out there. Oh, and you don't want to go through it. It's disheartening. It's sick. And these are young mamas with babies. Sickening. Whew. Whew. All right, hold it together. Because I plan to get pregnant soon, and I don't know if it would be best to breastfeed with my current state of health. I hope you can help me understand how to fix this. Thanks. Lori, let me say this. You sound like a very intelligent woman. So, use it to your advantage. Take the next year, tone, tighten. Make sure you get your kidneys filtering. No sore breast, no thick breast, no fibrocystic breast, but also anywhere else. Look at your eyes. See what weaknesses that you have. Make sure your adrenals are healthy, 120/60. Make sure your parathyroid, because if you have a parathyroid weakness and a connective tissue weakness, you're headed for postpartum depression, poor skeletal growth and connective tissue growth in the fetus. You see what I'm saying? And if you're not filtering, of course the fetus is not filtering. Okay, so there comes the tumors and the inflammation. Oh, guys. So you see where we're in trouble and why the babies are in trouble? And we can fix all this, and we have to fix this. Or, you know what's going to happen. Yes. Hi. You need to turn it up. I'll just come say hi. We're talking about saggy breasts, dense breasts, and things like this, because this lady's wanting to have children and her breasts are misshaped. And we're talking about connective tissue, parathyroid, and stuff like that.
Also, stop wearing bras.
From the woman itself. I agree with that, you know, and I don't care what society thinks. Quit wearing bras. When you see New Guinea, the villagers up in New Guinea, and their women are wearing, it's like, what? Mm-hmm. You know, it's like, come on, because what do we have around here, guys?
Mm-hmm. Well, you're restricting, especially the underwire. You're restricting that flow all through here, causing. They've even proven that it can cause breast cancer.
Look at that. I've heard that too. You know, and it's like, you know, I don't say that, but from a woman, shut the balls.
And what happens if you don't use a muscle?
Ooh.
It weakens.
It weakens.
So when you're holding these up all the time and you're not using these muscles, you're actually causing more sagginess.
You know, I never thought of that.
I haven't worn one for, well, maybe I shouldn't say.
Yeah, but that's pretty good, though. I never thought of that, but that might be true, you know. Yeah. Absolutely.
It does. I mean, it's actually been in studies.
Yeah. I've heard that about the bras and cancer, but I never thought of holding them too firm. It would not create a movement would be important to move lymph.
Absolutely.
I would get it. I would think that. I think all these things are so unnatural anyway, you know. And it's just our society, more Christianity than anything, no offense, but it's like, you know, button up and everything. Like, why? This is God-given.
We in America are, we look at sexuality first, and then motherhood and natural and everything else second. Yeah. So
she wants to breastfeed too, so I highly recommend that you become alkaline and that you eat an alkaline diet. That way your baby stays alkaline, get your kidneys filtering, because if not, the baby won't be filtering. Yeah. And tone and tighten before you have the baby. This is a smart lady. She wants to get herself strengthened up.
Yeah.
These guys are getting good now.
Oh yeah, absolutely. I just wanted to say Happy Easter to everyone. Love you.
Happy Easter.
Mwah. See you. I'm taking off for the day.
Oh, you want to have fun?
For the weekend. Friends coming into town. So.
Really? Oh, have fun.
We will.
You know, I'm going to be out working in the yard.
You're always out working in the yard.
I know, but I'm working around here so much that I don't get a chance to really, so I got to spend all weekend in the yard.
I know.
My plants are begging. Come see me. Come see me.
All right. Take care.
Good job.
Bye.
You guys are kicking. Good jobs. Interesting, though, thought about that. Holding them in place too tight could create a lot of stagnation of lymph. Interesting thought. Interesting thought there. So, that's from a woman. That's what I do. I would wait until I'm alkaline. Why? breast milk. If you eat an acid ash diet, your milk becomes acidic, and then your baby gets colicky and spitting up, but inside he's getting a lot of mucus and congestion, and then that's how tumors are formed. So you want to make sure if you're going to breastfeed that your milk is alkaline, ladies. Very important, because you don't want to acidify your babies and fill them full of mucus and congestion already, because then they get the cold and flus and fevers, and guess what? Into the ER they go. And if they're diagnosed with anything like a tumor thing, then you lose your baby. At least most of the mamas are. But thanks, sweetheart. Love you, dear. Good, smart thinking. Smart thinking. Urgent. Holy crap. You know, gotta call in. Urgent. I write for an 11-year-old boy who 2 years ago had ear infection treated with antibiotics. Infection cleared, but pain inside ear worsened to debilitating level. All right, so when we see infection, do you think bacteria is the cause of that? Hell no. You know, what is infection? It's acidosis, it's sewage, it's sludge. Where does that come from? Where do you suddenly have infection in your body? Could it be from the chemistry you're eating? Could it be from the dead animals and all those putrefacted proteins and all the grains and beans and all that crap? Absolutely is. Where do you get the sewage from? That's what people don't understand. It just developed from nowhere? No, it's cell metabolitic waste. That's the waste that has to go out the lymph system. And when it doesn't go out the lymph system, they call that infection when it backs up in places too much. And any bacteria that comes in, they're coming in to help clean up the mess, guys. Oh, and then the medical doctors, since they don't understand the God ways, then try to kill them. Well, there goes your bacteria in your lymph nodes, the gut, everywhere else too. Oh, nightmare. They set people off on nightmare journeys. Horrible. No. Where's that? You want to clean an infection out of your body, you do it through what channel? The lymphs. Here's a broken record. The lymphatic system. It's a sewer system. You wouldn't clean acids through your blood. It would be almost impossible because your body's not designed that way anyway. Although, when it backs up to a point, it can regurgitate right into the blood. So, not good. That's why there's dialysis. All right. Now, so, here's the thing. Same thing, guys. You can use ear candles. That's the best thing to do when you have someone in an ear pain or what they would call an ear infection or whatever. Ear candle. Ear candle, 3 or 4 candles per ear. What are you going to do? What system is involved in this young lad? Blood? Nope. Water? Nope. Ooh, there's only one more. That's the lymph system. And what are you going to start doing with this young lad? You're going to start making sure his kidneys are going to start filtering for him, because this lad's going to end up in trouble. He's already in trouble here. The next thing, he's going to lose his vision, pressure in the head. This backs up. You're going to have, because you got mastoids here, then you have equilibrium and vertigo problems, and now you're setting your lad up for ALS or MS. You want to deal with what is infectious. That is your sewer system internally. You know, everybody blames external things. Start thinking of the chemistry we're putting in and what's going on inside there. And so that's the trouble. This is acidosis and congestion and mucus, you know. And so you want to get the lad off of everything, put him on fruits, berries, and melons, detox this lad right out, candle the ears. If you want to work on the neurolymphatics down the back to help get things moving, get the sinuses drained. You got to pull and get this drained. The bowel has to be cleaned up in this young man. Get the kidneys filtering. That's what's urgent. 1 year bedridden. Holy crap. Constant pain that makes him madman. Seen 15 ENTs and that found no physical problem. Because it's systemic. Wait a minute. What is a new organ? Interstitial. It's interstitial, guys. They can't see it. There's another test. He has no problem. We can't see nothing. It's just in his head. He's in pain. Yeah, right. I don't know it. That's where Get over. It's where we walk in and say, you know what the problem is? The problem is the young lad's lymph system. That's acidosis. And the problem with that kind of acidosis and pain, it's corrosive. It's destructive. That's why there's inflammation to try and stop it. This isn't bacterium. This is acidosis. That's the problem with allopathic thinking. It's walking down wrong roads. That's why it's hurting so many people and not curing anybody, and stupid crap like this. I don't know why the little lad's in pain. We don't see anything. You don't? You don't have to see to know. Damn. He's on 2 SSRIs and 1 to calm nervous system. Meds make all touch pain. Oh yeah, cannot wear clothing, only thin bed sheet. Important, he is allergic to apples plus stone fruit. Thanks, plus love to you. Love to you, Melinda. My God, honey, you got to get your young man detoxed. He's so acidic you can't even touch him. He's in pain. That's not good for an 11-year-old boy. Oh, this young man's heading for all kinds of debilitating things. No. This is the time to get him. Detox, forget the antibiotics. These guys are nuts. You're going to ruin your young man's system here. No. You want to really detox this young man. Anything like that, when you're in pain, swelling, I don't care, ears, eyes, nose, throat, brain, tests, toes, detox. That's the only way. What are you going to treat it and stop it? What are you stopping? Acidosis. You're ketogenic acidosis, which creates acidosis. Not good. Not smart. Not good. Right? Now this young man, I've got to go here and we'll end it on this young man. But you fix this young man. This young man needs help bad in his lymphatic system. Get his kidneys filtering. You can use mullein in the ears if you want. There's mullein garlic, but mullein, basically, an anti-inflammatory. But candle, clean, and get the lymph system moving. It'll clean the ears and it'll heal whatever damage has been done. And clean this young man's, he's only 11, he's going into school. He's got to be open to learn and he's blocked up. So you want to open him up and take care of this young man and get his kidneys filtering because he could have a lot of trouble. I had a young man, I think he was 11, 12, or 13. Up in New York. This is about 20 years ago. Somewhere up in New York, and I forget who called me. The school? Somebody, his teacher, heard about me or something. Well, this young man, by the time he was 11 or 12, had over 30-some tumors in him, and they kept cutting them out of him. And I said to Mom, this is a lymph system. It's easy to fix this. Okay. So they brought him down, and the young man's sitting right in front of my desk like this. Right here, listening to every word I'm saying. And I'm right here with him, like this. Me and him, right here. And I'm explaining to him in the simplest terms of why he's having tumors, explaining the sewer system and the kidneys. He's getting it. And I said, I need you to live on a fruit diet for about 6 months. Think you can? He said, let me tell you. If I don't have to have another surgery and have a tumor removed, I'll do anything you say. The lad is free of tumors, was shortly after that, and has a good life. Cool? Cool. Love you guys. I'll be back to... Well, this got thicker. Did she drop some stuff off? I think she dropped some stuff off here. She did. Oh, wow, I think she did. Oh, this is neat. Oh, here's a guy from India. My dad got a tumor in his left mid-thigh. I've got all kinds of stuff here. So... God dang it. Don't wait till I answer you. You want to call in and get help or call one of or get a hold of one of the Facebook sites. I know they're all figs. He's trying to sell it because he's probably tired of it. There's a lot of work involved in helping others. And you have to have a strong, got to be strong because it's sad. What's going on out there, you know, and the babies and all the destruction that's going out there, and it's just sad stuff. So get yourselves healthy, especially your mothers before you have children. You can wait. There's no 1 year in your life to wait. If you're having babies out of emotionalism, that's the wrong reason to have them anyway. So it doesn't hurt just to wait for 6 months or a year, get your body healthy, get your body alkaline, because you do not want a sick child in this world. Not with what's going on with allopathically with children. And if you don't believe me, just talk to some parents. And more parents are calling us now, realizing some serious problems. Their babies are being grabbed by their feds or by, the law enforcement and medical doctors, thinking they know best and no one else knows anything out there. Is that narcissism at its highest? So all I've got to say is, I love you guys. You are showing the world the truth of God, the truth of nature, the truth of life, however you wish to look at that. And you have a pathway for you, your journey, your wellness, and a little secret how to go back to God again. How to wake up. Love ya.